You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says no one should be wearing a loose-fitting denture. He is Massachusetts' go-to implant dentist, Dr. Larry Burt. Dr. Burt, welcome to the program.
Thank you, Randy. Happy to be here.
Good. Now, before we get into today's topic, and I have a lot of questions for you, who's the typical dental implant patient? If you had to say there was a typical patient.
There's two main groups, Randy. The first one is people that have bad teeth. Their gums are swollen. They're in pain. They're red. They're just every day uncomfortable. They've got relatives, grandparents that have had dentures or have dentures now, and they just feel like they're headed to dentures anyway. The other group is people that are already in dentures. They've had dentures for years. They're just used to them, and they don't know if they have any other options. Both categories, Randy, they're headed to dentures. They don't want that. They don't want it to come in and out. So they come to us because they want something with implants. They want something to stay in. They want to be able to come in here, get their teeth out, get their implants, get their teeth, and walk out in the same day.
Now, we've talked on the phone. You say that people come in with really bad teeth, like the bleeding gums, the bad breath that you've talked about. And on the day of the procedure, you can remove the teeth, give them their new teeth, a full arch of teeth that don't come in or out in that one day. Is that true?
Absolutely. They can come in. Often we'll sedate them. We'll take their teeth out. We do anything else that needs to be done. Put the implants in and screw in the new teeth. So when they leave, their teeth are fixed in place, and they wake up and it's not even themselves.
Okay, good. How soon can they eat after the procedure?
As far as the implants and teeth are concerned, they can eat right away. It might be a little tender for a day or two, but they can certainly eat. And I hear people saying, they kind of start off soft and kind of cautious, but the next day they're biting into something a little more firm, and before you know it, they're into the hard stuff, vegetables and that steak they really haven't eaten in all these years because they've been afraid or they just couldn't.
Now, you're in the Boston area. Are there a lot of people that are wearing a denture or headed to a denture?
An enormous amount of people. If you think about people that are missing 6 or more teeth, and you add that to people that just have mouths that are just a big problem, the bleeding gums, the bad breath, the swelling, it hurts when they chew. Or some of these people, they wake up in the middle of the night. They have to call out of work the next day. Or maybe they don't go to a social event because, they're uncomfortable. Or they don't want to stay at a social event because they don't like the dentures they have. They're afraid of them. But I can guarantee you, they're not happy. They're tolerating them. But if you add all those people up, you could fill the Boston Garden up many times over.
So if there's so many people wearing dentures, okay, let's say tens of thousands of people wearing dentures in the Boston area, in Massachusetts, why aren't they all doing it? Why aren't they all coming in? Not aware of it? What is it?
Well, there's many reasons. First of all, they're out of the system. Whatever got them into dentures, they're like, mentally, psychologically, they're done. They just don't want to go through whatever they went through, and they've all been kind of traumatized, frankly. Whether it's from neglect or finances, or just didn't have opportunities. It doesn't matter why they went through this bad experience that got them into dentures. So if they're out of the system, they're not coming in. Maybe they're coming in once in a while for a sore spot, or they have to get a reline, which they don't like to do because now that costs money. Makes them fit a little better, but it's still a denture that comes in and out.
So these denture wearers just don't want to go to the dentist anymore. I mean, it's the last thing they want to do is see you. right?
Pretty much. Pretty much.
So they don't know their
Yes.
options. Is that what you're saying? They just don't know this exists?
Right. So they don't know their options. And, they might talk to their family and friends about dentures, but if they're not coming to a dentist who's got the ability to do the types of procedures that we can do here, then they don't know what they don't know. For the denture wearers, what they don't realize is that they can come in here and we'll give them as few as 4 implants with teeth on them, and they'll have a full arch of teeth that they can chew on almost immediately and be a lot more comfortable in as little as one visit. Listen, the bottom line is they've been told they're too old. There's not enough bone. They think they need an implant for every tooth they're missing, all of which is not true.
How old can you be to get this done?
There is no limit, Randy. The good news is it's routine. People can be 80, 85, 95 years old. I have colleagues that report doing this on 100-year-olds.
Now, why would a 95-year-old want to do this?
Well, here's the way I look at it. Why would a 95-year-old go to the hairdresser? Why would they go to the eye doctor to be able to see better? Why would they go maybe get a better hearing aid? Why would they go buy some new clothes? They want to live a better life for the life they have.
Okay.
If they're suffering through this denture that's loose, it's sore, it's smelly, it's ineffective, it's trapping food under it, they can't laugh or smile very well or very confidently, they're like, why wouldn't you want to do it? Let me tell you the story.
Okay.
So this is true. This is like a little dentist-to-dentist story.
Okay.
If you ask a denture wearer, as a dentist, you say, give me a smile. This is what they do. Say, okay, that's good. Give me a big smile. This is what they do. And they do that. I call it a half-effort smile because they're protecting their teeth. They're afraid that if they smile too big, those teeth are just going to fly right out. They don't even know they're doing
Do they
this.
tell you this sometimes?
No, it's subconscious.
Okay.
They're protecting themselves. Yeah, they're protecting themselves. But I can tell you that on the other side, when these cases are done, and I've seen this, certainly with implant and denture cases, but I've seen it in people where we restore their teeth. The same phenomenon happens. When they get that big smile, they just light up like that overnight. Here's the bottom line.
Okay.
Smiles are universal. It's like, this world gets smaller every day because of the internet and all that good stuff. And we all speak different languages. We have different cultures, but I can go anywhere on the face of the earth and smile, and I'll get a smile back. I can't say that with my language, but I can do it with my smile. And another reason, I don't want to get off on a tangent, another reason smiles are critical to people is that, we kind of judge people by A, if they smile at all, and B, if they have a nice smile. So I don't want to characterize other people, but if you think about it this way, think of a way the teeth look in some cartoon characters, or how do teeth look at Halloween on masks and stuff? Not very attractive, right? So
yeah, that's a good point. I mean, if you want to portray a mean person, you give them bad teeth. I think we talked about this, like in Hollywood, in a movie. If you want to make somebody look poor, like every director knows, you give them bad teeth.
Right.
So people are judged based on their teeth in some circumstances.
Or not smart, or not this, or not that, just not desirable in many different ways. Listen, if you had 2 people applying for the same job, okay, they have the same qualifications. They're clones, we'll say, except One has the bad smile or doesn't smile, and the other one has a pretty smile and smiles. Who are you going to hire?
Yeah. Well, you don't necessarily hire the one with a prettier smile, but if one is smiling and one isn't, you hire the one that looks happy, the one that looks confident. That's a very interesting point. Good. So, Dr. Burt, I mean, you've done a lot of training. You said your words were, I've had a ton of implant training. So these are the kind of things you didn't learn in dental school. So how does it work to get your training?
This is always an ongoing thing. You're always learning more. Believe me, I could just stack the papers and then the notebooks up, and then the years, literally years of mentors and curriculums that I've done for the training. The bottom line is this: I've been doing this so long, probably in one respect or the other, over 25 years.
Okay.
That because of what we've learned and through the process, and a big part of that is the digital era. It's the things we can do when we take. They're called cone beam scans, or like a CAT scan you get in the hospital. So we do scans, and we can scan your mouth, and we do all this digital work ahead of time. So it streamlines what the patient is subjected to.
By the way, you told me that you're actually doing the surgeries on the computer before you actually do them on the person. Is that right?
That's correct. That's correct. Absolutely. You virtually do it. I call it my game system. My kids have their game system. I have mine. So I, we do that. I do it in coordination with the dental lab. We do something called guided surgery. So we get these plastic, the hard guides that, show us exactly where we're going to go during the surgery. There's no question. It's, quick in, quick out. And all this together, my training, the digitalization, the coordination with the lab, you put all that in, turn on the blender, and that's what gets the patient in. Same day, teeth out, implants in, new teeth in, out the door, going home.
So when you told me that what used to take you like 10 months, now you can do in a very, very short period of time, maybe even as little as 2 or 3 visits. Is that mostly just because of the technology?
Well, I mean, certainly that's a big part of it, but the reality is there's a lot of places that still take 10 months, maybe longer. There are places that will, they'll do your exam, and then they send you to the oral surgeon, and then they send you out for a scan to a different place, and then they'll send you over here for something else. And then when that's all healed, then you go back to them, and maybe they'll build your teeth. And this, you're traveling all over town, and it just takes a lot of time. You don't need that anymore. There's no reason for it. And it not only complicates it for the patient, it ends up being more costly in money and time, and you have usually more discomfort. And frankly, you've got to build the rapport at 3, 4 different offices. Maybe you like most of them, maybe you won't like one, maybe you don't like 2. It just gets very complicated. And I'll tell you what ends up happening. The patient does nothing. The patient does nothing. They just they back off, and you'll see them 6 months, a year later, or they come in for their next reline. It's like, hey, I thought we were going to blah, blah, blah. And they're like, yeah, I just, that got complicated. But here, we don't have that problem. We do it all here in-house. We don't need to send you to a specialist. We have a scanner in-house. We have a lab we work closely with. You don't have to go to the lab. It's all silver tray service for you.
And you called it your digital workflow. That's using modern technology to do this.
Correct. Yes. It's exactly what it is.
Is this the future? I mean, is this the future of dentistry? I mean, the future 20 years, 50 years, 100 years? Dentures as we know them won't exist. They'll all be attached to something?
My best guess is, the always be other dentists doing other stuff, but cutting edge dentures are 10 years. I'm going to say 10 years. If,
They'll be
if you
gone.
get a yeah, if you get a traditional denture, you're going to be in the minority. The fees are coming down. It's just like anything else. The more technology kicks in, it's less time for everybody else to get involved.
Now, with your years of experience, you say over 25 years doing it, you have this center there in the Boston area where you do everything under one roof. Does it cost more to go to a guy like you?
No, actually, because of our workflow, it actually costs less. And we're able to save time and do so many things at one visit. I'm very easily able to pass that on to the patient. And so it can cost much less than going to separate providers.
Now, we're going to get emails about this, that, the best dental insurance only covers like a very small portion of this dental implant procedure. Medicare, Medicaid doesn't really cover this. So what's the answer?
The answer is we have multiple ways to assist patients in getting financing. If one doesn't work, we have another one or two that will probably most certainly help them out.
So you have to have decent credit, is that right? I mean, you have to have okay credit. But you're doing lenders that lend based on dental procedures.
Oh, absolutely. Absolutely. Yeah, it's not a problem at all. Literally, we do it every day for patients.
You say this can be life-changing for people.
Randy, it's just like the lady we were talking about, with the half-effort smile. That person comes in, they get the teeth. They're out socializing. A lot of people are dating later in life. I've heard they come back and we've had patients, we thought they just weren't happy people. Now we can't chase them out of the office at the end of their appointment because they're so social now, because they're happy, but they're also confident because they're not guarding their teeth from coming out. Does it change their lives? Absolutely. It happens all the time without fail. I have this one patient, Randy, that he was actually a tow truck driver on the expressway south of Boston. And, he wasn't real happy, but, his teeth were a mess. And he came in, we talked to him. This guy used to drink, and this is a true story, 2 6-packs of Mountain Dew a day.
Okay.
And let me tell you, that is like battery acid to your teeth.
Okay.
So not only is there a tooth problem, but there's a health problem. Anyway, we weaned him off that. We worked, we got his teeth work underway. And I remember the day we put all this in. Now, this is a tough guy, right?
Okay.
He's a tow truck driver on the highway in the middle of the night. He's a tough guy. And when we put those teeth in and let him see the final ones, the guy was speechless. I think I saw a tear in his eye, but I didn't have the nerve to ask him. But he was so happy. And afterwards, I approached him about taking some photos and kind of showing him the patients, and he said, absolutely. He couldn't wait. He couldn't wait to model his big new smile. And he was just ecstatic. And not only was he happy then, every time he came in, it was like a permanent thing. It wasn't like, oh, well, that was fun, but what now? This is a life-changing, life-lasting change for people.
So if a patient goes to you and they're in one of the two categories, they have currently wearing a denture, I want to know their options with dental implants, and then a person that, no matter what, you can't save their teeth. They need a full mouth of extractions. So what are their options in your office for implants?
Well, for both groups, it's the same list of options, Randy. Let's start with the simple one. You can put 2 implants on the bottom, and then there's a denture that will snap in. It's more secure because it snaps in, snaps out, but it snaps. It's not just what we call floating. That's the simplest, quickest way to do it. You can get the next step up is you can still have a removable denture, but you do it on 4 implants. You get more stability. Now you can start to eat things more confidently, salads, cucumbers, even nuts that you don't have to worry about the little particles of nuts getting under your dentures, and the next time you bite down, the nut gets driven right into your gums, and it's like a lightning rod going right through you. So with 4 implants on a removable denture, it's a lot more stable, a lot more secure, a lot more confidence for the patient. And you can do the same thing on top. You can do 2. Usually we do 4 just because of the anatomy. But you get the same result. But also, when you do the top, you can cut out the palate. So anybody that's seen a full upper denture, it's solid plastic, clear across the top of your mouth. Now, if you like your spices, you like wine, maybe you're a connoisseur of whiskey or whatever, you like those fine, subtle changes. You like to be able to detect them. If you've got a piece of plastic, it's like putting saran wrap across the top of your mouth. You've blocked, a tremendous amount. You've blocked a tremendous amount of the ability to smell and taste and salivate. So when you put those few implants on top, so you still have a denture that snaps in and out, but you open up the top of your mouth.
Okay.
It's a whole world. You really don't know what you've missed until you have it back. The next level up is what I think everybody really wants, because it's the top drawer and it's the closest thing to what we all had when we started life, and that's a full arch of teeth that stay in. We put somewhere between 4 and 6 implants in. We place the full arch in, and then you leave them there. You brush, you floss, you take care of them. Same thing on the bottom, if that's what you need and want. And you just care for them. You come in, the hygienist helps you.
So you take care of them just like regular teeth. I mean, you just go in, the hygienist helps you out, get cleanings.
Yeah, absolutely. It's routine care, both at home and here at the office. We'll check them. We'll clean around them, and everything. I got to tell you what usually happens, Randy.
Okay.
Everything is like great, and we probably spend more time socializing than talking about your dental problems, because you really don't have any anymore.
So no more cavities for sure when you got dental implants, right?
No more cavities. We'll keep those gums healthy, and you're back to where you were. You know what happens is, I think what people do, because I have people like they'll bring in a photograph. So maybe they're 50 years old, maybe they're 75 years old, doesn't matter. They'll bring in a photograph and say, I want my teeth to look like they did when I was 20. And when we give that to them, it's like they're reborn again.
Really?
It's like this is the first day of the rest of their life. They are thrilled, and they're not going to do anything to jeopardize that. They're going to take care of it, and we just have a great time. And like I said, I take ownership of it. If I see anything that needs to be addressed, we'll talk about it. But like I said, we like to spend most of our time socializing, because there's just not a lot of dentistry to talk about.
So is it more men or more women? It seems like more women would do this, because men put things off until they're in so much pain they call the dentist. Is it a mix?
Yeah, there's no doubt about that. Men are more bullheaded and tough guys, but we definitely treat men too. I have 3 cases of men going right now, and the thing about men is they put it off, but once they're in. Like, let's do this, and they want to move it along, and Like, can we do it yesterday?
Is it one of those things where they go, when it's all done, they go, I should have done this years ago?
Oh, absolutely, absolutely. I mean, they're like, I don't know what I waited for. I just it usually reflects back to why they're in dentures anyway. As to why they waited. The
Okay, good
the
point.
problems they had, the fear, the anxiety, all that baggage. And so, but they're certainly glad they did it. They don't regret it. I don't have one patient, right hand, that said, this isn't what I thought it would be. And
Okay.
that doesn't happen. That doesn't happen.
So what do they like more? Do they like that they can eat now whatever they want, or do they like the appearance better?
Well, it's so funny, Randy. You get the people that come in. It's usually the guys. Oh, I just want them to work better. I don't care what they look like. And then you get people that like, I want them to look good. Well, one complements the other. And for the guys that where you get them to where they work better, they start smiling a little bit because they're happy about that they function better because that's what they wanted. That was up their priority list. And then, one of their buddies says, wow, your smile looks pretty good. Like that looks good. And then they go down the road and before they know it, they've got a half dozen and dozen compliments. And now they're like, they're a happier person. It's like, who is this person? Because that person isn't the person that was in my office on day one. And frankly, I get this story usually from the wives. It's like he's turned into a much happier, go-lucky person ever since he got his teeth fixed. And the women are the same way. They all of a sudden they're cutting their hair different, or they might be wearing a little different clothes, and or their nail polish might be a little brighter or on the edge compared to what we're used to seeing.
So you see, you told me sometimes they come in, you don't even recognize them, like because they're acting different, like confidence-wise.
I'll hear somebody and like I'll be down the hall around the corner. I'll say to my assistant, "Who is that?" And they'll tell me. I'm like, "No way! How can that be?" Because I know that person is not that loud, not that funny, not not that chatty, And sure enough, there they are. So it's the best part of the job.
Okay.
I love the technical part of everything I do, but just seeing people come out of their shells because this has held them back for so long is enormous. I mean, my whole staff, we just, after the patient leaves, we just high five and really celebrate that we pulled it off again.
Dr. Burt, we are out of time. So final message to the person out there, they're of the two groups. They have really bad teeth that cannot be saved, and they know one thing, they don't want a denture. The other group are the denture wearers, which you say are hard to get in, but you could help the most. But let's say they've heard what you had to say. Right. What do you say to them? And they're still skeptical. What do you say to them?
I would just say, I invite you to come in, meet our team, meet us, and learn what your options are. We'll give you a treatment plan in writing. You'll know exactly where you stand. Good. And we'll go from there.
Do they still get to meet you, or you're too big of a big shot these days?
You'll definitely meet me.
Okay, good. Hey, I want to thank you for coming on the show. Good stuff. Thank you very much.
Thank you.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.